Good afternoon, everyone. Welcome and thank you all for joining us today for Dr. Dow's second webinar with us this year. Let me start by asking, have you ever wished you could stand beside a master acupuncturist and watch exactly how he treats neck and shoulder pain for fast, reliable results? If you're ready to step into Dr. Dow's clinic and learn his treatment methods, type yes in the chat room. 好多人想要跟你学。对，你看，都说 yes, yes, yes. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 900 courses, and 3,000 hours of CE. Today's class is straight to the point. Ashi Acupuncture for neck and shoulder pain from 50 plus years of experience. Sponsored by Evergreen Herbs. In this class, you will gain access to pre-recorded special live clinical footage from Dr. Kai-Fong Tiao's own practice, where he demonstrates his time-tested approach to treating neck and shoulder pain, palpating and selecting Ashi points with precision, and applying needling techniques designed for rapid and effective pain relief. This way, we won't have any no-shows in person, and we get to pick the best case demos for you to learn from. As an added bonus, we have also included 6 additional case demos for you to watch when the distance learning course is available in 2 to 3 business days. It is my great pleasure to introduce today's speaker, Dr. Kai-Fong Tiu, a master acupuncturist with over 50 years of clinical experience, specializing in sports injuries and musculoskeletal trauma. Dr. Tiu is renowned for achieving fast, often immediate pain relief through his refined palpation and needling techniques. He formerly served as a professor of orthopedics and traumatology at the Chinese Academy of Traditional Chinese Medicine, is a member of the Chinese Pain Society, and holds a diploma in orthopedic and chiropractic medicine from the School of Medicine in Jingnan University. His decades of clinical mastery and teaching make this an exceptionally rare and valuable learning experience. I would also like to introduce and thank Tina Chen, licensed acupuncturist and herbal consultant at Evergreen Herbs, for joining us and translating Dr. Diao's top treatment tips that he is most generously sharing with us today. Additionally, I want to mention that Dr. Diao has many other classes on Ashi points with us on eLotus, such as classes for how to treat acute pain, chronic pain, back pain, and more. And this year, we will present his most recent case studies of Ashi points for hand and foot pain on April 27, elbow and arm pain on July 27, and knee and leg pain on November 16. They are all on Mondays, so it's hard to forget the day. If you're interested in learning more about Dr. Diao and his courses, I'll send the links to the chat room for you shortly. And remember, if you're a Gold Pass member, you have access to all of Dr. Diao's courses, as well as 900 plus other courses in our library, and all of our upcoming live webinars on eLotus. It's a great way to learn from the best teachers, elevate your practice, and get free herbs from our sponsor, Evergreen Herbs. I'll put more information about our Gold Pass in the chat room for you shortly as well. And before we begin, a quick reminder to set your chat from host and panelists to everyone so that everyone can be part of the conversation. If you have any questions during the webinar, please use the Q&A box. And lastly, the quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar, and please join me in welcoming Dr. Diao and Tina Chen. 好。
Hello, everyone. Good to see you again. My name is Tina Chen. I think most of you know me. I have been around for a long time, I think too long. But in this field, I'm very excited because I get to work with masters like him. And while Myra was doing the intro, I was thinking, Dr. Dell looks like a celebrity. And my nephew says, he looks like Jet Li's grandpa. And I thought, wow, he does. Same eyebrows, same eyes. So we're very fortunate to have him here today. He is, I think, 84. 84岁了哈. He's 84 this year, and he's still practicing. He drove here today, and he's in amazing spirit, and he's happy to teach all that he knows today, everything about the neck and shoulders. So we are very fortunate. 谢谢你，戴医师今天来。好。Yeah, he says you're welcome, everyone. Now, can I quickly take a look at how many of you are new to eLotus? Would you put in the chat room new to eLotus if you're new? Kind of want to see how many people are new, so I get an idea of how much to introduce. Okay. How many of you are new to Dr. Dell's method? This is your first Dr. Dell class. Can you put new Dr. Dell? TIU. 看看我问他们谁是新来的，没有听过的。哇，好多个，1、2、3、4、5、6、7、8、9、10、11、12、13。Oh, very good. Well, welcome everyone. How did you hear about him and hear about this class? Wow, we have so many new students today. I'm excited because you will be blown away today. When I first was treated by Dr. Dell and introduced to his method, I thought, wow, this is the very typical Chinese method. It's very aggressive, very painful, but it's very effective. So I usually save this method, not for the very sensitive patients or the ones that are not that severe. I save this method for the very, very tough ones. So what you will learn today is one more thing in your sleeve that you could use, and it's super effective. So let's, without further ado, go straight into class. Now you can see the lecture notes, okay, right, everyone? If you cannot, I think you can see it behind us too. So the overview today is we're gonna go over Dr. Dell's 50 years of experience that I, work with him, had dinner with him, go to his clinic. This is what I do. I just seek out the masters and then I go, pick their brains and then bring them out. And so today what we'll do is in the first 30 minutes, I will cover what his key points are to his method, what's important for you to know. I think 50 tips, something like that, 40 or 50 tips, I can't remember. But this is something that as an acupuncturist and you're working hands-on, is something that you realize after working on so many patients, these enlightenment, aha moments. So that we will go over first. And then after that, as Myra mentioned, we'll play some of the best case studies that we have recorded in his clinic. And then there are other bonus ones that we put into Blue Course Access page for you to watch later. And then after each case study, we'll do the question and answer. So if you are watching him doing his, needling, if you have any questions, feel free to put it in the Q&A. This is the best time to pick their brain. So I'm happy to help. Don't be shy. There's no stupid question. I ask stupid questions all the time, and that's how you become better. Okay? Now, let's get started. When you first graduate from school, I had this issue. Oh gosh, I thought I knew everything, because I passed the board. Now I'm ready to treat anything and everything under the sky. And when I had my first patient, that was when I thought, oh, this is nothing like the textbooks. Then you go and continually to seek out different masters who are very good clinically, right? Because theory is one thing, clinical practice is another. And we want to get the effect because that's what the patients want. They don't want to hear you talk about yin and yang and all that. You can hear that on YouTube. So there are so many different styles. Which style do you like? And I'm sure you'll find a teacher that you like, that you resonate with. The Bagua frequency is similar in the I Ching, according to that. The reason I say that is this is the latest teacher I'm studying with, the Bagua acupuncture guy that I found in Taiwan. Later on this year, I will be giving some classes on that with him. Okay, so Dr. Dell, he started practicing in Hong Kong back in the 60s, 70s. And he did exactly kind of like what we did. He hosted CEU courses for acupuncturists. So he invited a lot of good doctors and practitioners from China. So he learned almost every different kinds of style of acupuncture. And then finally at the end, he says, whatever he's practicing now is the most practical and the most effective. So he's here to share that with you today. All right. So let's get started with tip number 1 or question number 1. I wanted to make this a little more interactive because I realized a couple of years ago when we were going over these tips, a lot of people still ask the same questions during the demo. So I decided to, okay, let me change the tip from a straight statement into a question. So if you want to participate and have a little bit of fun just to see how much knowledge you have compared to Dr. Dell and then see where you are, is as I'm asking these questions, you can put your comment in the chat room so everybody can see as well, and then we can learn from one another, because that's really important. When we graduate, we're sort of thrown out into the world to practice with no mentor, no support whatsoever. So this is a great opportunity so that we can learn from one another. I'm learning every day as I, speak to different practitioners too. So this first one is not a question. It's basically for the five key steps. When he is doing Ashi acupuncture, he doesn't do any distal needling. Everything is local, Ashi. So the key steps in doing Ashi needling, is it just, okay, well, patient tells you where is the pain and then you just needle there, or do you actually feel yourself? So for him, he says he will first ask the patient to identify the most painful area or most painful spot. Sometimes it's an area they don't really know exactly where. Sometimes they do. So ask them to first tell you where. Then second is you want to palpate for any hardness or any cord. Cord meaning it's it could be like a guitar string or a very tight tendon or whatever it is. You palpate around the area. So this part is what is a little bit harder because it takes experience. Because in the beginning, when I was following him in his clinic, he says, feel this, feel this. I couldn't feel anything. Just like the beginning when I studied with Dr. Jimmy Chang, feeling the pulse, didn't feel anything. But over time, as you feel more and then, close your eyes, put your mind to it, you will feel more. So what you want to do is, number 2, feel the cord or hardness. Number 3 is to hold that point and don't let it go. And next is you want to use the other hand to needle while you're holding that particular area or that particular hardness in place. Because if you let go and come back, you might not get it. And you're not needling around the area of where the hardness is. You're needling directly into it. And then we will go into how deep in a little bit. It's part of his tip. And then number 5, in order for the treatment to be effective, you have to ask the patient how they feel, right? When your needle is in and when you're stimulating, because they have to have the deqi sensation. And that I think everybody knows, because, if they don't feel it, it's like needling into a tofu. They don't feel it, you don't feel it, and then they're not going to feel anything afterwards. So these are the 5 key steps. Every single step is important. If you skip it, you might not get the same result. All right, next. All right, so number 2, what should you do if you cannot feel the Ashi point of the knot? That was my first problem when he showed me, okay, feel this. I don't feel anything. Well, what do you do if you don't feel anything? He says, if you don't feel anything, then you can expand the area and search more. So if the patient says the pain is here, you can't feel it, and then you would expand the area slowly and carefully, right? Surrounding the area to see if you will find anything that is abnormal compared to the other side or compared to the local tissues nearby. And if you find any knot or any kind of cord, any kind of hardness, that's where you're going to have to break up the stagnation, okay? Number 3, which hand is more important? Is it the needling hand or the palpating hand? For him, it's the palpating hand. So when you watch the case study, the demo later, you will see that his left hand will never leave where the knot is. Never. So that one, he says, is more important because the needling hand is just insertion. Okay? And the tendons tend to be slippery. So that's why the palpation hand is more important, because you have to hold it in place. Question number 4. What gauge does Dr. Dao use for his treatment and why? And what gauge do you guys use? I use gauge 38, but Dr. Dao uses gauge 30. Very typical of Chinese style acupuncture. Master Tong also uses gauge 30 needles because, they want to get that stronger De Qi sensation. Number 5, does Dr. Dao wear gloves during the treatment? Yes, he does, because sometimes there may be bleeding after needle is extracted. And recently, I just went back to my other Sifu, Dr. Jimmy Chang, to learn herbs and pulses. And he is actually wearing gloves now too to take the pulse. Very interesting. He buys those very thin kitchen prep, disposable gloves, and then he wears a mask and he wears a glove. And I said, wow, Sifu, is that really necessary? He said, you have no idea. Patients are very dirty. If you know Dr. Jimmy Chang, you know how he is. So that's what he says. I said, okay. You can still feel everything. Now, number 6, how many needles do you guys typically use? Can you put in the chat room? Let me see. How many needles do you guys use? How many needles do you think Dr. Dao uses? I have another teacher, Dr. Lin in New York. He has a class on E-Lotus too. He says he uses no more than 4, max 5. And that's how his teacher taught him. Because for example, if you're needling a yang problem or like a qi problem and you want to pick Li4, you would only pick the right side. You don't need to needle the left side. So, he only taught me a couple of concepts, but I thought it was amazing, 5 needles. Dr. Esther Su is also another doctor that we had for Master Tong. She uses less than 10 needles too. Very few needles. She says the more, not the merrier. But they practice a different style. Dr. Dao here, he uses as many needles as necessary. I have seen him use 20 to 30 needles before. And I don't know if it's in this class that you will see that, but whenever he sees a knot, he will put the needles there. Another knot, he will put more needles. And then when the patient feels better, that area feels better. And then there are other, related areas with pain, then he will needle some more. So yeah, a lot of needles. Okay, next one. What should you do if your patient has more than one pain area? So what he does is he works on the main area first. And then once that area is better, then he'll work on the related area nearby. However, if they have, like, for example, neck pain, and then, you're treating the neck and they'll say, I have back and knee pain. The Dr. Dao will usually say, okay, well, I can treat them, but then I will charge you extra, like each location is one extra charge if they don't want to come back another time. So something that you can consider. Number 8, what is your needling technique to attain the De Qi? And what do you think Dr. Dao's needling technique is to achieve the De Qi? So this is the part on stimulation of the needle. I have learned from different peoples, and everybody uses a different technique. Some use clockwise, some use up and down, technique, right? And then some use electrostim with different frequency. And if you do scalp acupuncture, Dr. Zhao does the stimulation 200 times a minute. I don't know how he does it. I think he has a lot of interns to help, because 200 stimulations a minute is a lot if you have 100 patients a day. And for Dr. Dao's technique, he actually doesn't really do the manual stimulation. What he does is he pushes around the needle. So you will see that in the demo. So what he'll do is he'll needle the patient, right? And with the needle in the patient, he doesn't move the needle so much. He pushes around here. So at first I thought he is like looking for more knots, but he's not. This, he says, is enough stimulation. So I thought that was pretty interesting. I tried it on myself and just kind of feel like, the De Qi sensation doing it this way as opposed to manipulating the needle. And they're both pretty effective. So that's some new tip that you can try if you have never tried that before. Okay. Next is when the knot is very stiff or very tight, what Dr. Dale does is he will actually then use the needle to break it up. So let's say this is the skin, okay? And then this is the skin, this is the knot under the skin. So what he does when he needles it, he doesn't just touch the knot. What he will do is he will penetrate it like this and sometimes go through to break up the knot. Can you guys see? I think it's pretty clear. So he doesn't touch it, he goes through the knot. So it's much like that, the needle knife therapy. Have you guys seen that? I posted it on my Facebook one time. It looks very painful is when they take like a little surgical needle in the shape of a knife and they go in to break up the fascia. So this is sort of like that idea, but it's not that aggressive, you know. So it's just to elicit like a little mini trauma in the area so the body can heal. Okay, so what do you do if the patients are sensitive to pain? We have a lot of that. So when Dr. Dale says they're very sensitive to pain, what you can do is you can do cupping first. And why is that? It's because the cupping will numb the area. Okay, so once the area is numb and he goes in with the needle, then you can't feel it as much. Okay, so if you guys, I don't know how your setting is in your computer. If you are seeing the video screen to be very small and the slides very big, I think you can toggle in the middle, right, Myra? There's like a little divider in the middle that you can pull. So you can see the video portion bigger and the lecture notes portion smaller. Okay, number 10. How long do you leave the needles in for the patient? Okay, Dr. Dal says, there is no need to leave the needles in for more than 15 minutes. If you attain the de qi sensation, it's actually fine to remove the needles immediately. However, he does let them rest and, you know, rest for 30, 40 minutes because the patient, you know, when receiving a treatment, they will feel like they want to get their money worth a little more. So then they want to stay there a little longer. That's what he says, the patient psychology. And then also they can relax. And if they fall asleep, the treatment will be that much better too. So there is no, you know how the theory goes that the qi circulates in all the meridians or all the channels in 40 minutes, right? Runs through all the channels. And that's one complete cycle. Your treatment will be better. But for this method, not necessary. Once you have the de qi, you can actually remove it. 对不对，刁医师？ I'm gonna interact with him a little bit so he didn't get bored. 这个得气之后就可以拔针了嘛，对吧？不用等很久了。
你有时间就留一下也可以。
是啊，他们心情会比较好。
就是你不留也可以，就反正有酸胀疼就有效了。
Yeah, he said you can leave it or you don't have to leave it, but you have to get the soreness, you know, numbness, the de qi sensation. If you don't get it, it's not going to be effective, even if you leave it a long time. Okay? All right. With aggressive needling and bleeding and cupping, how long do you feel the patient will show effect? So this method, okay, with the patients that we have worked with and I've seen in his clinic and the demos, etc., about half of the patient immediately feels much better. The other half feel worse. And the other half, and the first half is when you tell them this method, unlike other methods where, you know, you have immediate relief, but then tomorrow, the next day, the effect goes down. So then they have to come back again. His method is very interesting because I think it's because of the trauma that you're causing, you know, in the local area, because the treatment effect is very aggressive. And I feel personally pretty painful. That the next day they will usually feel the pain is worse, and then it will get better. And as it gets better, the pain won't come back. You don't need to come back, basically. So unless they're very severe, then they have to keep coming back. Otherwise, they don't. It's just right after the treatment, the local area is inflamed, so it's more painful. But after that, then it's all good. All right, number 12. Where should you needle if the location of the pain cannot be needled? This was one of the questions a student asked a couple years ago. And I thought, oh, that's a great question. And then Dr. Dell said, well, if you cannot needle there, you will needle around there. So you palpate around the area to find the knot. Number 13, does he use a TDP lamp? He does, but he doesn't use it for its effect. He uses it so that the patient doesn't feel cold and feels more comfortable. 14, does he use electrostim? Do you use electrostim? And again, he does not use electrostim because the manual technique is already very strong. And then with him pushing on the skin nearby, that's already very strong stimulation. Number 15, what is the contraindication for his Ashi needling? Okay, one is pregnancy. So he says, during pregnancy, you don't want to needle any points on the back. And then definitely no needling if she's 8 months or more pregnant. Number 2, the contraindications for needling are the thoracic points because you can easily do pneumothorax. That could easily happen. And since we're talking about the neck and shoulder today, towards the end, I'm going to ask Dr. Dao to do a demo live on where can you needle and where can you not needle on the upper back. Because I remember a couple years ago when he did a class, he showed us how to do it. And he said, if you're not experienced, you should not do it. Better just not to do it. Then I was thinking, well, then how do we get better if we don't do it, right? So then he said, okay, then do it slowly, shallow, and be very careful. Okay, number 16, what supplies do you use when you're bloodletting? He uses disposable cups. He uses disposable gloves. And then following of course, the proper bloodletting protocols. And what he does is the cups, he will sell to the patient and then tell the patient to go disinfect it themselves at home and then bring it back the next treatment if they need to come. Or just leave it with them. They can do their own cupping if they want to sometimes, at home. But he doesn't ever reuse the cups. Number 17, what do you do if there's no obvious knot when you're palpating your patient? This is a good question for beginners because in the beginning, you don't feel anything. So what he does, this is a really, really good tip, is you go ahead and do the cupping first. Once you do the cupping, the local area fascia is rearranged. Then the knot is going to come up and it's going to be a lot easier to feel. So just for this tip, tomorrow you should try it out, as you are trying to feel the knot. Number 18, what should you do if some patients don't have any specific area of pain? We actually had that demo too. So if they don't have any specific area of pain, then you don't need to retain the needle. And then just ask them, okay, well, if it's not one fixed location that is painful all the time, where is your pain usually? So if they tell you here, there, then you just go ahead and needle all those places. That's the answer. Number 19. Okay, this is regarding bleeding now. If you're doing bloodletting, how many holes do you poke before you do the cup to suck out the blood? How many holes do you guys poke? Can you put in the chat room? I want to see how many. Do you do one poke and then one suction cup? 2, 3 pokes, 1 suction cup? Or do you do more? Can you type in the chat room for me? 我在问他们学生啊，放血的时候啊，他们用那个针啊，戳几个洞才用那个杯子拔。你看，2个、3个、4个、10个、3到5个、3个。
严重的多打几个嘛，无所谓的，打多没有规定打多少了，你看情况。
你说多打几个是多打几个是多少个？20个。
多打几个洞。
对对对。
多打几个洞。 严重的多打几个，多放一点；不太严重的就不需要放太多的时候少打一点。
He
你
said,
看情况。
depends if the condition is severe, more. It's not severe, less. You know, these Chinese masters, when they say that, I always want to get to the bottom of it. What exactly do you mean by more or less? So here's our answer right here. Generally speaking, he does 5 to 7. You know, he has that lancet needle with the pen that's disposable. Mara, can you help put the link for people? You can buy it on Amazon. It's just a regular lancet pen. He takes out the cap, so then there's no contamination. He just has the lancet needle on the pen. And then so, you know, then he would just do 5 pokes and then he'll put 1 cup. Another 5 to 7 pokes, another cup. But I have seen him up to 20 pokes per cup. And I thought, wow, boy, this is like a very spicy dish. If it was a dish, that's very extreme. But then the patient was in a lot of pain. You will see in, I think, demo 1, he did a lot of poking. Okay. 不好意思，他们如果他们那个粥不能放血怎么办呢？
不能放血，那个可以嘛？是不是？你
就是法规不允许啊。
法规不允许啊？有这样子做的吗？
什么？
有这样子的地方吗？这个地方不
有一些地方是不能。I asked him, so what if the area you're in, the state or country you're in, you know, the regulations do not allow you to do bloodletting, then what do you do?
不允许看到血呀、啊。那没人，他不准放，你就不放了嘛，没办法。
Then he just said, then you just don't do the bleeding. Do the cupping. You can do the needling, or you can do the needling and then cupping. And if some blood happens to come out after the needling, well, you're not bloodletting. It just came out, right, from the needle.
你不放多一下，拔罐，
对，
还有贴药膏。
Oh, yeah.
贴我那个药膏。
He said another thing is you do the cupping, like I was saying. And another thing I didn't mention is you use the plaster. He has a very, very special formula, including 4 or 5 herbs that's good for all kinds of trauma. It's such a good special formula, but you can't apply it for more than, I would say, I don't know, 12 hours because it is very strong. It does cause a rash on people, but it's very effective for sprains and strains and trauma and bruises, etc. We have made a video and put it on YouTube. So the ingredients of those trauma plaster is in the description section. So I'll ask Myra to put the link, save that link, okay? Because just to get that formula from a master, it takes years or sometimes not. And because Dr. Diao is so generous and also past his 80s, I feel like Chinese doctors are like that. Once they get, I hate to say this, like they get old enough and they feel like I need to pass my information down is when they will actually do it. Any earlier time you ask them, they'll just say, no, you know, you have to come to my clinic to be a slave for longer, or you have to marry my son or my daughter, whatever, to give you the secret formula, secret sauce. Okay, number 20, for acute pain, should you bleed or should you needle first? You guys know this answer? The answer is for acute pain, it's much, much more effective if you bleed first and then needle second. Much more effective. So then that begs the question, okay, so what if I'm poking 10 or 20 the most for acute pain? Let's say this patient comes in, he cannot walk, cannot bend his back. Am I gonna, poke 20 holes, suction, 1 cup, do another 20 holes, another section, suction? Let's say we do 5 cups. Is that blood gonna stop, or is that, because you're doing suction cup, right? So theoretically, there's negative pressure and the blood should just keep coming out. That was actually my question to him. And he said, no, the blood will stop even with the cup. Once the area of stagnation, whatever the blood is stuck in that area causing the pain is all pulled out. The body will not bleed anymore, let's say. So this is talking about bleed, poking holes in the muscles and tendons area, not like, you're poking a vein or poking an artery, then of course the blood is going to come out, okay? The question here is, will the bleeding stop if you keep bloodletting? And the answer is, it will stop. Don't worry about over bleeding the patient. When everything stuck is pulled out, then the area will be able to flow smoothly again with clean blood. Okay, so the stagnated part is eliminated. Then that's why it will make your acupuncture that much more effective. Okay, so if you're in a state where you can bleed, by all means, do this first. Try tomorrow. Surprise yourself. Okay, number 22. For chronic pain, do you bleed first or needle first? So the question is that, and the answer is exactly the opposite. You needle first, and then if the patient is fine, you don't need to bleed. If it is not all that fine, then you bleed. So my logic or my rationale behind that is because chronic pain, there's less like dead blood stuck there. It's more like wear and tear type of thing. So sometimes you don't need to bleed because there isn't really that much dead blood. I feel like if you have a lot of dead blood, it's because you've had a past trauma there. Like I've seen some patients with like, headaches as a result of a fall, and then they hit their head from a long time ago. And those kind of people, they will have this headache that comes and goes, and then, at random times. And those are the people I feel like they have some dead blood. And those are the people you need to do bleeding. Chronic pain, you need to do a little bleeding. And then very effective if you use those insect and bug type of herbs. For those kind of problems, the regular blood movers, 红花, 桃仁, 川芎, that's not going to do it. They will move blood, but it's not going to go into the crevices and chew up and eliminate that dead blood that's been stuck there for years. Okay, number 23, should the patient shower after bloodletting? Good question. This is a question just like moxa. So after bloodletting, don't shower or bathe for 12 hours. Same thing with moxa. Don't want to do that. Just leave the body alone, let it rebalance and recalibrate. And then is there a need to put on any ointment because sometimes it looks really red and, angry? No, he doesn't put on any ointments either. Number 24, what areas on the body is safer to do bloodletting rather than needling? So there are some places, right, you don't want to needle, but you can bleed, and that is right here. Bladder 43 area, very, very good to bleed, but you don't want to needle because of neurothorax, right? And Master Tong's method, we have it in the Master Tong website core, this core section on eLotus. Under Master Tong, there are a bunch of thoracic points you can check out. Most of them are all for bloodletting. And I remember Dr. Chuan-Ming Wang, who is the youngest disciple of Master Tong, when he used to lecture for us, and before he passed away, he said, we were chatting after class, and he said that I should have died a long time ago. But if it wasn't for all the bleeding that I did or my wife did on my back, the thoracic points, I wouldn't be alive today, because he had kidney issues. I think finally passed away last year. Very sad. All of Master Tong's students all pass away now, the first generation. Okay, number 25. How do we control the amount of blood being sucked out from the cup? I mean, basically the question is, how long do you leave the cups in before you take it out? So number one is, if you want to bleed more, you can, when you're using the lancet needle to pull out blood, you can go a little deeper. So a little deeper, there will be a little more blood. And then number two, if you want more blood, then you can poke more holes, of course, right? If it's more severe, you poke more holes, then you have more blood. And then number three is the number of pump. You guys all know like the cupping, right? He doesn't use fire cup. He uses the plastic one with a pump. So the question is, how many times do you suck, push the pump? So the answer is until when you push the gun until you see the skin elevated in the cup becomes purple. You usually do it about 3 times. And then when you see it about purple, or when the blood feels about 1/3 or half of the cup, is when you need to take it out. Okay, so again, you usually do three with the gun, 3 pumps. And then when you have enough blood is when you see that the area looks purple, or you have blood for at least 1/3 of the cup or half. And then number 4 is, the length of time is, you can see it in the patient's cup, it will look like jello inside. And that is ready for you to take out the cup. And you will see it in the demo that we're going to be playing, how Dr. Diao removes the cup. There is a certain way so that the blood doesn't get everywhere. Number 26, what do you mean, or what does it mean when you see bubbles in the blood? Have you seen that before? So bubbles. So some teachers say, oh, that's extra qi. But Dr. Diao says, no, that just means your suction cup is not tight enough. So, there's air and blood is leaking out, air coming in. So you have to readjust it and then do a couple more suctions. Number 27. What does it mean when you see mist in the blood in the cup? So sometimes the cup looks a little misty. I think this picture is kind of like that. Yeah, like this. Can you see in the lecture notes, right? It looks like there is moisture. So what that means is that the patient has dampness. So these patients, usually when he sees this on a patient, here's the picture. He'll ask them, do you like to eat sweet things? Do you like to eat cold things? Or do you like to eat raw sushi or dairy? So all of those will basically injure the spleen, and then spleen will not be able to handle the dampness, and it'll manifest like this. Number 28, do you bleed the extremities, the toes and the fingers? So that's gonna be our next class in April. Yes, he does bleed the joint, and it is more painful just because there's so many nerves there in the hand and in the feet, but he does. So in that area, you can't use a cup, right? There are little ones that you can use on some areas of the hand and foot, but what he does is he will needle the joint and he will squeeze out the blood. Sometimes you will see fluids come out in addition to the blood. Okay, number 29. How long is a session of bloodletting with the cup? So this is, generally speaking, like I was saying, until the skin turns purple, right? Or until the blood becomes like jello, or if you have already gotten 1/3 or half of the cup. Or generally 5 to 10 minutes, it's good, ready to go. Number 30, contraindication. What are the contraindications to bloodletting? Number 1, patients who are on blood thinners, right? These patients are going to continue to bleed. Not like what we talked about earlier, where the bleeding will stop once the stagnated blood is removed. If you're on a blood thinner or Coumadin, it's going to continue. And then number 2, diabetic patients. So I asked him, well, then what do you do with those patients? Did they still have pain? And then so he says, yeah, you can still do the bleeding, but you just do it very gently. Don't use as many, don't poke as many holes, and don't let it sit there for that long. Just do a little bit of bleeding. It's better than no bleeding at all. Okay, so we have finished his 30 tips. These are like cumulative experiences that he has gathered in his 50 years of practice. Now, as we're going to take a little 2 minutes break, we're going to prepare to show you the first demo. You will see all of what I talked about at play. He's going to be doing all of this. So watch carefully the palpating hand and the needling hand. Watch carefully when he's doing the bloodletting, and also watch carefully when he's doing the cupping. And if you have any questions, please write them down in the Q&A, and then I will translate to ask Dr. Dell, and then we'll go on to the next case and the next case. Okay, so let's take a little short break, 2 minutes, and then we will start.